John Faulkner is a certified Epic ClinDoc Stork case management and security consultant with a passion for technology and helping others. He's successfully turned his passion into a career. He strives to provide an unforgettable experience for his clients every step of the way, and with years of experience working with top healthcare organisations, John is knowledgeable, reliable and passionate, dedicated to providing world-class service. And John is on the line with us here. How are you today?
I'm great. How are you, Toby?
I'm brilliant, thank you. So, what actually is an Epic consultant? Because that maybe sounds like you're blowing your own trumpet a bit there.
Yeah, it does. It probably sounds like a mythical creature of some sort.
Yeah.
So actually what that is, so I'm actually an electronic health records consultant, and the software I specialize in is called Epic, and they're based out of Madison, Wisconsin, technically Verona, Wisconsin. So that is their main training center. And a lot of the big health systems across the world use it. There's hospitals in the UK. There's also the Mayo Clinic, Cleveland Clinic. I'm trying to think of some others. Kaiser Permanente. They use the Epic electronic health record as well. And it's basically just where physicians and nurses and other clinicians document in the patient record. So when you go to the doctor's office, and they use Epic, that's basically what I'm helping them configure, set up, customize for their hospital.
So why would a hospital or business need a consultant? Because most systems are simple enough that you don't need to hire a consultant for it.
Yes. Epic, unfortunately, is very complicated. So they have the Epic, what they call the base foundation software that comes out of the box. And they need us to basically come in right at the beginning to implement it for all their staff, or they have us come in kind of later on and customize everything because they have what's in it called modules, and they have all those little pen names that I gave you, like ClinDoc, Stork, security, case management. So those are all specialties within that electronic health record software.
So what would you say sets your services apart from other Epic consultants out there?
I've been in the game for a long time, almost 11 years, and I pride myself on just extremely high quality, doing things a little different. A lot of people don't talk about what we do in my industry for some reason. It's kind of like taboo.
Yeah.
So people just don't ever talk about it. So I'm trying to think outside the box, come up with like really creative solutions, and that's where I set myself apart.
Your service could be seen as something that's maybe mundane and something that has to be done. Is there a lot of space for creativity?
Yeah, there is. There's a lot of customization available within the Epic electronic health record, which is really nice. Sometimes we do run into a bit of source code, which is not what we do. We're kind of basically experts at finding settings, and then we're called builders. So we move things around and make it look more pretty for you or operate in a way that makes more sense. So more like something you may think about or heard people talk about in an electronic health record is, hey, there's a lot of clicks. You hear doctors complain about that. So part of my job is to improve that experience, make it better for them.
Your clients, is it valuable to them that it looks pretty and is creative? Because I suppose at the end of the day, the end goal is productivity, isn't it? So is it still valuable for them to have a nice looking system?
Yeah, it's very valuable because it attracts other clinicians as well. There's a lot of competition out there between hospitals with their Epic electronic health record, because you'll have physicians and nurses come from other hospitals that use Epic, and they'll be like, hey, how come we don't have this here?
Yeah.
And so it kind of puts the pressure on the organizations to really outperform each other because they're trying to meet regulatory requirements. And what it really comes down to is patient care. That's the ultimate goal, making sure that the patient is not being asked the same questions like 10 times, and that the processes are much more efficient. And the hospitals, a lot of times, they're trying to just not only make that experience better, but save their patients money as well.
And is the system so big? Just because hospitals have got so many records that they need to have, both of patients and staff, because, here, the NHS is the biggest employer in the country. They've got millions of people nationwide on a system, don't they?
Yes, they do. There's so many patient records, and I think Epic's minimum requirement for an organization to use Epic, I think, is like 1 million patient encounters. Don't quote me on that, but that's a number I think I've heard before. So it's a very complex system. Not only are we talking about Epic, we're talking about all those third-party systems that integrate. So we have fetal monitoring systems, we have imaging systems, we have the beginnings of other softwares that are auditing as a layer over Epic, so that it's tracking your clicks in the system for court cases and things. So it's a very complex, smart system that not only protects you as a clinician, but protects our patients.
Yeah. So how did you actually get started working in the healthcare technology industry?
Yeah, so that's kind of a funny story. I actually used to be a teacher. So I have started with no healthcare experience whatsoever. I have received a phone call from a recruiter, an IT recruiter, about an hour before I got married on May 19th, 2012. So that's how I got my humble beginnings. And they're like, hey, you want to do this thing called Epic? You get to train emergency department staff, so like doctors and nurses, on how to use this EHR system. It's a 6-month contract, so I was going to be a consultant. And they said, hey, we'll pay you $20 an hour. And at that time, I was like, heck yeah, let's do it. Because like I could not find a job for the life of me. I think it had been 3 years I was looking after graduating college. So I said, yeah, let's do it. Let's get started. And that's how it kicked off.
And was this just a completely random call? Like they just put in some random numbers into the phone and ended up with you? Or did they actually target you because they thought you'd be good?
Yeah, so they targeted me. If you've heard of the company Kelly Services, I used to be a substitute teacher through them, and they contacted them and then they said, hey, we just need a bunch of people that are good at training people. So they contacted me, not because for my clinical experience. I think part of it, to be honest, was because it's cheaper, because I had no experience, and that they could train us within a very short time period to get this hospital to implement Epic at the time. And this was based in Lansing.
How do you actually balance your career as an Epic consultant with being a father of 3 and everything else you're doing?
Yeah, so it can be very complicated because most of my job is remote, especially since COVID has happened. So I have a set of twins, or 3, and then I have about a 1.5-year-old. So I hire people to help me, to be honest, because I'm a solo consultant. And I subcontract work out to get everything done I need to get done for my business. And then I'm also highly organized through a calendar that I use called Motion. And then I've started utilizing AI tools too as well, like Read.io for my meeting minutes and things. Provides a nice summary and takes all notes for me, and then I can send it to my clients right afterwards to make things real clean.
Makes it so much easier and saves so much time. And do you find that time is money in your experience, or is time just time to spend with family, I suppose? And because even if you're not going to make more money from it, we all want to do things that will make us work less hours.
Yeah, it's really about results, to be honest, more than hours. Because I've been doing it a while, I can get work done in a fraction of the time compared to like a newer analyst, just because I know what to look for. I know what the settings are. I know how to fix things efficiently. Usually as a consultant, I'm given the hardest issues that other analysts can't figure out. I'm given that by my managers and directors at the hospital. So issues that might take months to fix or even a year to fix. And they know that giving it to me. So it's more about the results, I would say.
How long do you typically spend working with a particular client on a particular project?
Yeah, so it's very normal to start off as a consultant doing about a 3-month contract, and then it renews on a quarterly cycle based on, budgets that are getting approved through the hospital. And I usually find out, I'd say about 3 or 4 weeks before the end of that contract when it gets renewed.
So are you consulting them kind of indefinitely? It's just continuous. They don't tend to just need your help for one thing and then you're gone. It's a continuing relationship.
Yeah, exactly. And a lot of what I do too, because it's hard to explain sometimes, but the best way to think about it is like I'm doing like operational work sometimes. If there's like a hospital already using Epic, I'm basically taking tickets from the help desk. I'm like the tier 2 support. And then I take those issues on if there's something broken in Epic or if they just want an enhancement, and we manage all the upgrades too. So basically, like you think about release notes on your iPhone for upgrades, those are things we manage within Epic as well.
Have you ever had any challenges when doing your consultancy work? Maybe something that a client has needed help with that you just can't figure out how to fix?
Oh yeah, I don't have all the answers. So I'm more than happy to admit that. I've found that early on in my career, if I pretend like I know what I'm talking about, people see that and they pick up on that. They really respect you when you just say, I don't know, but let me get
Yeah.
back to you. So not that you're never going to have an answer. You're going to use your resources to get it for them.
Yeah. How do you kind of build a rapport with your clients and I suppose have them be able to trust you? Because I guess what you just said is part of that, isn't it? Being honest with them and admitting when you don't know what you're doing.
Yeah, absolutely. So I used to be a full-time employee, so I know that feeling when you have an outsider basically coming in and then not really telling you what to do, but giving you recommendations from the get-go because we're expected to pick up things right away. So that can be difficult sometimes for people to work with, but that's why I do a lot of things like this, like podcast, interviews, building up my website, making things look professional, posting content on LinkedIn 5 days a week and Twitter, and posting content on YouTube because I want to build that rapport and trust online because that's the business model today. A lot of it is online. So
Yeah.
if I can kind of nurture those relationships implicitly over time, that makes it a lot easier for me once they're finally ready to work with me.
And you mentioned that you used to be a full-time employee and now you're running your own business. So do you prefer this way of life? Do you feel freer now?
Yeah, I feel more respected and a bit more free as well. I can say, no, I don't want to work. Obviously, the caveat of that is I don't have any paid time off. So when I'm not working, I'm not making money. I don't have a good income stream yet, passive income stream to keep making me money when I'm off. So those are things that I'm trying to work on at this time, trying to just get creative about things. So
I suppose the ironic downside is that you say you don't have to work when you don't want to, but I guess because you're not employed, some people will try and work as much as they can and make as much money as they can, whereas you don't necessarily have to worry about that if you're employed because your money will be the same and you're told when to work most of the time.
correct. Yeah. And the nice part is I'm not usually on call too. That's another thing. When you work at a hospital, you're on call and that means that you can be called at any time during the day, night for a period of time, like a week or longer. I don't have any of those things. That's like a big plus for me with kids and just makes my life a lot less stressful.
Yes,
So
certainly.
I really like that because it can be stressful when you got someone like at the hospital and they're having an issue and they're yelling at you at 2 o'clock in the morning. It's not a fun experience. So
No, I wouldn't want to sign up to that. So what is coming up for you? Do you have any exciting projects that you're working on or just plans to grow the business, maybe even work on a passive income stream for when you're on holiday?
yeah, so about a year ago, I started something that's called Epic Career Coaching. And I know when people think coaching, it's like, oh, there's just like this thing that some guy made up. I saw a huge need for this in my market, in my niche market, because no one is teaching people how to get into this market and no one is teaching them how to get into like analyst jobs or how to become a consultant in this industry. So I'm very passionate about that because I used to be a teacher. So that's something I'm trying to passively work on, create more kind of automated processes for that so then I can start making income when I'm not working too, because I'm making recorded sessions and things.
Well, where are we able to find all your consulting services and coaching and keep up to date with you everywhere?
Yeah, so LinkedIn is my primary platform where I'm at, but you can also follow me on Twitter and YouTube. And then my website is johnfaulknerllc.com.
Excellent. Well, many thanks for talking to us today. It's been great having you on.
Thank you, Toby.